Hello, and welcome to Introduction to Healthcare. I am your instructor, Mrs. Angela. I basically today we're going to go over the background of healthcare and the healthcare regulations. I hope you're ready. Let's go. Let's bypass the CPT copyright. All right, so here we go. Introduction to Healthcare. Background of healthcare, healthcare regulations. That includes, we will be discussing Health Insurance Portability and Accountability Act, which is called HIPAA, conditions of participation, fraud versus abuse, False Claims Act. Federal regulations include the Stark Law, anti-kickback, and healthcare fraud. Also, we'll be discussing Truth in Lending Act. And lastly, the Quality Payments Program. Sorry about that. So let's start. The background in healthcare. Healthcare insurance introduced as an employment benefit. This started in 1942. The Stabilization Act, which include wages and price control placed on employers. It allowed adoption of employees' insurance plans. In 1954, the Internal Revenue Codes started, and it had the employers contribute to the employees' health plans exempt for taxable income. Next, Medicare passed into law in 1965 with an automatic enrollment for Part A, optioned enrollment for Part B. In 1973, the HMO plan, which is the Health Maintenance Organization, started, and it proposed to help control healthcare costs. It authorized 375 million to assist in establishing and expanding HMO plans. My favorite preference is the PPO, which is called a Preferred Provider Organization. It assists groups of doctors, hospitals, and other healthcare providers, but they give more options. Now, let's talk about HIPAA, Health Insurance Portability and Accountability Act. It provides rights to participants and beneficiaries of group health plans, pre-existing condition limited, this discrimination against employees and their dependents based on health status prohibited. Healthcare fraud and abuse control programs was the comprehensive program to combat fraud committed against all health plans, both public and private. Annual reports identified actions that were taken. The administrative significance was the privacy, security, and electronic transaction standards and code sets. Now, let's talk about privacy rules. This was a set standard for how an individual's protected health information, which stands for PHI, is used. In that sense, part of HIPAA, those covered entities were health plans, health providers, and also health care clearinghouses. The privacy rule also covered business associates, which includes perform certain functions or activities which involve the use or disclosure of PHI on behalf of a covered entity. Health information technology for the economic and clinical health. These entities, such as health information exchange organizations, will be treated as a business associate. Makes business associates liable for HIPAA compliance. Business associates also include contract required when using a business associate. If a covered entity identifies a material breach or a violation of the contract, reasonable steps must be taken to cure the breach or end the violation. It is not possible. The contract must be terminated and the problem reported to the HHS Office for Civil Rights. Now, let's talk more into depth when it comes to HIPAA. Let's talk about the privacy rules and the de-identifications. What it all includes in the de-identifications. Let's talk about it. We also have names, the names of the patients, demographic information, geographical subdivision smaller than a state, including the street address, their city, their county, zip codes, and other information that could be included in that. Dates directly related to the individual's treatment, such as the date of birth, their administration dates, their admission dates, the discharge dates, and also includes death of the dates of the patient. Phone numbers, fax numbers, emails, social security numbers, medical record number, health plan ID numbers, account numbers, certificate license numbers, their vehicle identification serial numbers. They're even on their car license plates. Device identifiers and serial numbers such as implants or other devices that could have been used for the patient. Web Universal Resources Locator, the URLs and Internet Protocol addresses, their IP addresses. Biometric identifiers such as finger or face recognition, and other things that can identify the patient. Those are what's called de-identifiers and are part of HIPAA that cannot be released to anyone else without any permission. Let's go deeper in depth. This Privacy Act rule also includes and discloses permitted use of disclosure of PHI, which is that patient health information, allows covered entities to use and disclose certain information without an individual's authorization in the following situations only. Number one, to the individual who is the subject of the information. Number two, PHI may be used by a covered entity for treatment, payment, and health care operations activities. Number three, the individual may grant informational permission by being asked outright, giving them the opportunity to agree or object to circumstances where the individual is not capable of providing his or her signature. Lastly, incidental use and disclosure is permitted as long as the covered entity has reasonable safeguards in place to ensure that the information being shared is limited to the minimum necessary as required by the privacy rule, according to the Office of Civil Rights. An incidental use or disclosure to a secondary use of disclosure that cannot be reasonable but prevented is limited in nature, and that occurs as a result of another use or disclosure that is permitted by the rule. Minimum necessary. Covered entities must take reasonable steps to limit the use or disclosure of and request for PHI, the minimum necessary to accomplish the intended purpose. Covered entities are required to develop and implement policies and procedures to reasonable limits using or uses of disclosure to the minimum necessary. Now, let's talk about the national priority purposes. Number one, it's required by law. Number two, public health activities. Number three, victims of abuse, neglect, or domestic violence. Number four, health oversight activities. Number five, judicial and administrative procedures or proceedings. Number six, law enforcement purposes. Number seven, descendants. Number eight, they have the organs, eyes, or tissue donation. Number nine, research. Number 10, serious threat to health or safety. Number 11, essential government functions. And lastly, number 12, workers' comp. The privacy practice notice. A privacy practice notice must be provided by each covered entity. Covered entities are required to supply a notice to anyone upon request, whether direct or indirect treatment was provided. A healthcare provider must make a good faith effort to obtain written acknowledgement from the patients that the patients have received the privacy practice for. In most cases, individuals have the right to review and obtain a copy of their PHI at any time. Privacy rules also include all covered entities must have written privacy policies that comply with the privacy rule. A privacy official must be designated. All members of covered entities' workforce must be trained. Covered entities are required to migrate any harmful effect that may have been caused by inappropriate use or disclosure of PHI. Procedures must be in place to allow an individual to comply or complain about a covered entity's compliance. A covered entity may not go against a person for exercising his or her rights provided by the privacy rule. Privacy policies must be maintained by covered entities for 6 years after the later of the date of their creation or last effective date. Security rules. The HIPAA security rules was established by the HIPAA Administrative Significations Regulations to establish nation standards to protect and secure patients' data that is stored, transmitted electronically. It is required that appropriate safeguards are in place, such as under administrative, physical, and technical. Transactions. These standard transactions are called electronic data exchange, which you'll hear very frequently called EDI. These EDI or electronic data exchange transactions include claims and encounter information, healthcare payments and remittance, healthcare claim status, eligibility for health plans, enrollment and disenrollment in the health plans, referrals and authorizations, coordination of benefits, and lastly, health plan premium payments. The code sets. Now, these code sets are actually established by HIPAA, and we have to be compliant with them as well. Those particular code sets includes Healthcare Common Procedural Coding Systems, which is called HCPCS, your CPT, which is called your Current Procedural Terminology, your ICD-10-CM, which is the International Classification of Disease, 10th Revision, Clinical Modification. NDC are national drug codes that are assigned to any medication or drugs that will be used. CDT is for the current dental terminology. And lastly, place of service codes. The following healthcare organizations that are part of the healthcare regulations are ambulatory surgery centers, community mental health centers, comprehensive outpatient rehabilitation facilities, critical assessment hospitals, end-stage renal disease facilities, federal qualified healthcare centers, all the way to transplant centers. And in order to find these particular healthcare organizations under the healthcare regulations, you can follow the actual link below with our CMS.gov. Records retention through CMS. Medical records must be retained in their original or legally reproduced form for a period of at least 5 years. For providers submitting cost reports, records, or to be retained in their original or legal reproductive form for at least a period of 5 years at the closure of the cost report. For management care programs, providers are to retain records for 10 years. Medical records may be retained in any media format, which include paper, electronic, or digital. Fraud versus abuse. This is a very important part, and knowing the difference between the two will make you a very different thinker when it comes to coding and billing. Let's start with fraud. Fraud, knowingly or should have known, making a false statement or misrepresentation faced to obtain an underserved benefit or payment from a federal healthcare program. Those examples are billing for services and or supplies that you know were not furnished or provided, altering claim forms and or receipts to receive a higher payment amount, billing a Medicare patient above the allowed amount for services, billing for services at a higher level than provided or necessary, misrepresenting the diagnosis to justify payment, falsely documentation. Now, let's talk about abuse. Abuse, an action that results in unnecessary costs to a federal healthcare program, either directly or indirectly. Those examples include misusing codes on a claim, charging excessively for services or supplies, billing for services that were not medically necessary, failure to maintain adequate medical or financial records, improper billing practices, billing Medicare patients a higher fee schedule than non-Medicare patients. This is all are examples of abuse. False Claims Act, FCA. Number 1, knowingly present of causes to be presented a false or fraudulent claim for payment and approval. Knowingly makes uses or causes to be made or used a false record or statement materials to a false or fraudulent claim. Conspire to commit a violation of subparagraph A, B, D, E, F, or G. Has possession, custody, or control of property or money used or to be used by the government and knowingly develop or delivering or causing to be delivered less than all of the money or property. Is authorized to make or deliver a document certifying receipt of property used or to be used by the government and intended to defraud the government, makes or delivers the receipt without completely knowing that the information on the receipt is true. Knowingly buys or receives as a plea of an obligation or debt public property from an officer or employee of the government or a member of the Air Forces who lawfully may not sell or plead property. Knowingly makes, use, or causes to be made or use a false report or record or statement materials to an obligation to pay or transmit money or property to the government, or knowingly conceals or knowingly and improperly avoids or decreases an obligation to pay or transmit money or property to the government. Examples of false claims acts are falsely a medical chart notation, submitting claims for services not performed, not requested, or unnecessary, submitting claims for expired drugs, upcoding, bundling services, submitting claims for physician services performed by a non-physician provider, NPP, without regards to incident to the guidelines. And failure to return overpayments is a violation under the FCA as well. The FCA is violated by submitting a false claim with knowledge that it is false. The terms knowing and knowingly. Let's see the difference. A means that a person with respect to information as accurate knowledge of the information, acts in deliberate ignorance of the truth or falsifying of the information, or acts in reckless regards of the truth or falsely of the information. And B, required no proof of specific intent to defraud. Q10, the whistleblower may bring civil action on behalf of themselves and the U.S. government. The government chooses whether to interfere. The Quartam relates may be awarded 15 to 25% of the dollar amount recovered. Common defense, government contractors and subcontractors, colleges, universities, medical care providers such as physicians, clinics, and hospitals, HMO plans, and also federal guarantors. Designated Health Services, DHS. This bans referrals to entities for the DHS. The Physician Self-Referral Law is also known as the Stark Law, as it was named after Pete Stark. The law prohibits physicians for referring patients to receive designated health services from entities which with the physician or an immediate family member has a financial relationship, with a few exemptions. This law applies to services payable by Medicare or Medicaid. Proof of specific intent to violate the law is not required. Penalties for physicians who violate the Stark Law includes fines as well as exclusions for participation in federal health care programs. Those actual DHA services are clinical laboratory services, physical therapy services, occupational radiology, radiation, durable medical equipment and supplies, parental and external nutritional equipment and supplies, prosthetics, orthodontic devices and supplies, home healthcare services, outpatient prescription drugs, and also inpatient and outpatient hospital services. Prohibits remuneration to induce or reward patients' referral. This is an anti-kickback law. The anti-kickback law is similar to the Stark Law, but imposes more severe penalties, making it a felony to receive payment or in return for referring a patient to another entity. This law requires proof of intention and states that the person must knowingly and willfully violate the law. This law applies to referrals from anyone, not just the physicians, and applies to any items or services. Penalties include criminal fines up to $25,000 before annual inflation adjustment per violation, and up to 5 years prison term per violation. I know you don't want to do that. In addition, civil penalties may be applied, including False Claims Act liability, civil monetary penalties and program exclusions, and potential 5,000 CMP per violation. Civil assessments of up to 3 times the amount of kickback. Truth in Lending Act. This protects consumers in their dealings with lenders or creditors. If the practice assesses a financial charge, the amount of the financial charge must be disclosed as an annual percentage rate, APR. Payment plans that extend past 4 installments require the following to disclose: the cash price of the services, the amount of any down payment, the result of unpaid balance, the total amount financed, the amount of the finance charge, the annual percentage rate of the finance charge, the total price to be paid under the credit plan, the schedule of the payments, including number, amount, and due dates, the sum of the scheduled payments and total payments, and the amount or method of computing the amount of any late payment charges. Lastly, Quality Payment Program, which is QPP. This is Medicare assesses and CHIP Reauthorization Act of 2015, Moret-based incentive payment system, and advanced alternative payment models. You can also see all of them on the cms.gov website link that is in the actual program here. Moret Payment Incentive Payment System: quality, promoting interpretation, and improvement activity and cost. So that does conclude the ending of Introduction to Coding. See you soon. Thanks.